Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning. I see we have a few things on our agenda today, especially concerning your blood pressure and the swelling in your legs. How have you been feeling overall?
It's been a bit rough, honestly. My blood pressure has been high despite the medications, and the swelling in my legs just doesn't seem to stay down unless I keep them raised most of the day. It's getting frustrating.
I understand that must be very uncomfortable. Have you noticed any changes or patterns in the swelling that might help us pinpoint something specific?
Well, it definitely gets worse throughout the day. By night, my socks leave deep marks around my ankles. Elevating my legs helps, but it's not practical during the day. I've also started using the compression stockings you recommended last time.
Good, those should help. And how about your heart palpitations? You mentioned they occur occasionally.
Yes, those are still happening. Sometimes I feel my heart suddenly beats faster, especially if I'm stressed. It's concerning, but pacemaker checks have been normal so far.
It's good to keep track of those episodes. Stress can certainly impact your heart rate. Let's also talk about your liver health. Any updates from the liver clinic?
They told me the new mass looks like a benign hemangioma. That was a relief, but I'm worried it could change, knowing my history with liver cancer.
Understandably so. We'll keep a close eye on that with regular scans. How have you been managing your arthritis and urinary incontinence?
The arthritis is as usual, some good days, some bad. I manage the pain with over-the-counter meds when it gets bad. The incontinence clamp helps, but it's not a perfect solution. I still have accidents sometimes, especially at night.
That sounds challenging. Managing these symptoms day to day can affect your quality of life. We'll see if there are other supportive measures we can suggest. Have you had any recent infections or other new health issues?
No new infections, thankfully. I stopped the sulfamethoxazole as it was upsetting my stomach, but we had talked about possibly starting it again.
Yes, preventing UTIs is important, especially given your symptoms. We'll discuss the options for that. Now let's review some of the clinical values from your recent tests to get a clearer picture.
Please do. I'm always a bit anxious about what they show.
Understandable. Your blood pressure readings from the recent visit are slightly high, with a reading of 162/90 mmHg on the right arm and 158/88 mmHg on the left arm. Your resting heart rate is stable at 78 beats per minute, which is good considering your palpitations.
That's a relief to hear.
In terms of your blood work, your serum creatinine is at 1.2 milligrams per deciliter, and your eGFR is 60 milliliters, which indicates stable kidney function. Your cholesterol levels are slightly elevated with a total cholesterol of 105 milligrams per deciliter, LDL at 130, and triglycerides at 180 milligrams per deciliter. Your liver function tests look normal, which is excellent news.
So, what should we do next?
Firstly, I'm going to increase your lisinopril dose to help better manage your blood pressure. We need to keep an eye on your kidney function and electrolytes because of the increased dose, so I'll schedule another blood test in a few weeks.
Got it, and the palpitations?
Keep monitoring heart palpitation episodes. If they increase in frequency or intensity, we might consider adjusting your heart medications. I'll also arrange for a DEXA scan to check your bone density, considering your arthritis and history of cancer treatment, which can impact your bones.
Thank you, doctor. It feels good to have a plan.
Absolutely. It's important to stay proactive about these things. Keep me updated on any changes, especially with the palpitations or swelling.
Will do. Thanks for all your help today.
You're welcome. Take care and see you soon.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning, John. How have you been feeling since your last visit?
Hello, Dr. Smith. Honestly, it's been a bit rough. I've been having more frequent headaches, and they can be quite severe at times. I'm also still concerned about my epilepsy. The last seizure was really intense and required an ICU stay.
I remember reading about your hospitalization. Can you tell me more about what happened during that seizure?
Sure. It happened suddenly. I felt this overwhelming sensation, and then everything just went blank. When I woke up, I was already in the hospital. It was frightening, not just for me, but for my family as well.
That sounds very challenging. Have you noticed anything that might be triggering these seizures?
I've tried to figure that out, but there's nothing I can pinpoint exactly. It seems random, which makes it all the more unpredictable and stressful.
Understandable. Let's also talk about your headaches. You mentioned they've been getting worse?
Yes, they're more frequent, and sometimes I just have to lie down until they pass. I'm taking aspirin, about 4 to 6 pills a day, but I'm not sure it's a good idea to continue with that much.
We'll definitely look into that. You've also mentioned some memory concerns. Could you elaborate on that?
Well, it's both frustrating and a bit scary. I struggle to remember recent conversations and sometimes even important dates. My family has noticed it too, and it's becoming a point of tension at home.
Memory issues can indeed be very distressing. We'll need to consider how your medications and overall health might be impacting your cognitive functions. You also mentioned a burning sensation around your heart. Tell me more about that.
It's like a sharp burning pain, like razors. It doesn't last long, but it's very uncomfortable. It doesn't happen often, maybe a few times a month, but when it does, it really catches my attention.
That's certainly something we should investigate further. Have there been any changes in your work life or daily activities that could be contributing to your symptoms?
I work long hours at my desk, and I've started to feel some numbness in my hands occasionally. I'm worried it might be carpal tunnel, given how much typing I do.
Occupational hazards like that are definitely worth assessing. We'll consider how your work environment and habits might be impacting your health. Lastly, how are you managing with your daily activities and overall mood?
It's a struggle, Dr. Smith. I try to keep up, but I often feel overwhelmed and anxious about my health. There are days I can't eat properly because I'm just not hungry or too stressed.
Thank you for sharing all of this, John. It's important for us to understand the full picture so we can manage your health effectively. Let's go over some of your recent clinical results to start formulating a plan.
Thank you, Dr. Smith. I appreciate that.
First, your blood pressure is at 103/85 millimeter Hg, which is slightly elevated, and your heart rate is stable at 72 BPM. Your respiratory rate is normal at 16 breaths per minute, and your body temperature is also normal at 98.6. Your BMI is at 25, which is in the healthy range, and your fasting blood glucose is well controlled at 95 milligrams per Gillers. Looking at your blood work, your complete blood count is stable with a hemoglobin of 14.5 gram-Dal, white cells at 7.2 by 10^3 UL, and platelets at 250 by 10^3 UL. Your liver and kidney functions are within normal limits, which is excellent. Your electrolytes are also balanced. The EEG showed some sharp waves, which correlates with your epilepsy, but there was no seizure activity during the test. Your EKG and chest X-ray were both normal. Based on all this, my plan is to continue monitoring your epilepsy closely. I'll refer you to a neurologist to address the headaches and review your seizure management. We need to discuss your aspirin use and potentially adjust it to avoid any gastrointestinal risks. I'd also recommend a cardiology consult for the burning sensation you've described. For your hand symptoms, an assessment for carpal tunnel syndrome seems prudent, and perhaps an ergonomic evaluation to ensure your workstation is set up properly. Lastly, given your stress and anxiety, it might be helpful to connect with a counselor or psychologist to develop better coping mechanisms.
That sounds comprehensive, Dr. Smith. I'm glad we're looking into all these aspects.
Absolutely, John. It's important we address everything that's affecting your health. Let's schedule a follow-up appointment in 6 weeks. You'll receive a notification by mail with the exact date and time. Please bring your hospital discharge paperwork next time, and in the meantime, your medication refills are processed.
Will do, Dr. Smith. Thanks for your help today.
You're welcome, John. Take care, and see you soon.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Thank you for coming in today. I understand you have concerns about fertility. Could you tell me more about your current situation and any symptoms you might be experiencing?
Yes, thank you, doctor. We've been trying to conceive for over a year now without success. I'm worried because I'm not getting any younger, and I've heard that can make things more difficult.
That's a valid concern, and I'm glad you brought it up. Age can be a factor, but there are many options we can explore. Have you had any previous medical evaluations related to fertility?
No, This is the first time we're seeking medical advice. What kind of options are available for us?
We'll start with some basic tests to check both your and your partner's health and reproductive functions. Depending on the results, we can consider treatments such as medication, assisted reproductive technologies, or possibly lifestyle changes.
Now look at question 26.
Good morning, everyone. Today I'm going to discuss an issue that's both sensitive and significant: addiction among healthcare workers. As professionals who dedicate their lives to caring for others, the pressures can sometimes lead to unhealthy coping mechanisms, including substance abuse. Statistics indicate that healthcare professionals are at a higher risk for addiction compared to the general population. The reasons range from the high-stress environment, easy access to medications, to the physical demands of the job. It's crucial for healthcare facilities to implement supportive policies and programs that provide help without stigma. Regular training, confidential counseling, and a culture of wellness can make a significant difference. Remember, taking care of ourselves is the first step in being able to care for others effectively.
Now look at question 27.
Today, we need to discuss the hormone therapy options available to you, considering your symptoms and health history. Can you update me on how you've been feeling lately with your current regimen?
Honestly, I've been feeling a bit off. I'm experiencing more fatigue and some mood swings that weren't there before.
Those symptoms can indeed be related to hormonal imbalances. Adjusting your hormone therapy could potentially help. We'll need to conduct some blood tests to see your current hormone levels and then decide on a possible adjustment.
What are the risks of adjusting my hormone therapy?
Like any treatment, there are risks involved, such as changes in mood, weight, and other metabolic parameters. We'll monitor you closely and make adjustments as necessary to minimize these risks.
Now look at question 28.
Welcome, everyone. Today's focus is on preventing injuries in the hospital setting, a critical aspect of our work environment. First, let's talk about common causes of injuries among hospital staff. Slips, trips, and falls are the most frequent accidents. Implementing simple safety protocols such as proper signage when floors are wet and ensuring that walkways are clear can significantly reduce these incidents. Another key area is patient handling. Proper training on how to lift and transfer patients using the correct techniques and equipment is essential to prevent back and musculoskeletal injuries. Lastly, workplace violence is an increasing concern. Training staff to handle aggressive behaviors and having clear policies in place can help manage these situations safely.
Now look at question 29.
I've been having trouble sleeping for the past few months. It's starting to affect my daily life. What can I do to improve my sleep?
Let's start by looking at your sleep hygiene. What's your routine before going to bed?
I usually watch TV or scroll through my phone until I feel tired.
It's important to avoid screens before bed because the blue light can disrupt your body's natural sleep-wake cycle. Instead, try reading a book or listening to calming music as part of your nightly routine. Also, keeping a consistent sleep schedule, even on weekends, can help regulate your sleep patterns.
I'll try those suggestions. What if they don't work?
If you continue to struggle, we can explore other options such as cognitive behavioral therapy for insomnia or possibly medication. But let's start with these changes first.
Now look at question 30.
Thank you all for gathering here today. We're here to address the delayed response in patient care that occurred last week and to ensure it doesn't happen again.
Yes, it was a serious issue. The delay in emergency response time was due to multiple system failures, including communication breakdowns and staffing shortages. We need a robust plan to tackle these issues.
Agreed. Improving our communication systems is a priority. We also need to address staffing, perhaps by hiring more staff or adjusting shifts to ensure adequate coverage at all times.
In addition, implementing more rigorous training for handling high-pressure situations could help. It's vital that every team member knows exactly what to do when emergencies arise.
Absolutely. Let's outline these action steps and assign responsibilities. We need to improve our protocols and ensure we are prepared to provide timely and efficient care to every patient.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Today, we delve into a complex and pivotal issue in vascular neurology, specifically the management of asymptomatic carotid artery stenosis. Our conversation will span from the historical context of its treatment to the modern advancements and clinical trials that shape current practices. This topic is particularly relevant given the ongoing CREST-2 trials, which may redefine our approach. We'll also discuss a case study to highlight the nuances in clinical decision-making for these patients. Let's begin by setting the stage with some historical insights. Traditionally, the management of carotid artery stenosis has been bifurcated into surgical and medical pathways. Historically, revascularization procedures such as carotid endarterectomy have shown benefit in reducing stroke risk in patients with significant stenosis. However, these interventions are not without risks, particularly perioperative complications such as stroke or death. In the late 1980s and 1990s, landmark trials like the NASCET and ECST provided evidence supporting revascularization in symptomatic patients, showing a significant reduction in stroke risk when stenosis was greater than 70%. However, the scenario is less clear in asymptomatic patients. The ACAS and ACST trials hinted at benefits from surgery in asymptomatic individuals, but raised questions about the balance of risk and benefit, especially in the context of modern medical management. Fast forward to the present, the landscape of medical management has evolved dramatically. The introduction of potent statins, advancements in hypertensive care, and lifestyle modifications have all contributed to a lower baseline risk of stroke in these patients. Observational studies now suggest that the risk of stroke in medically managed patients might be as low as 1% per year. This brings us to the question, do these patients still benefit from surgical intervention, or has medical management sufficiently closed the gap? Let's discuss a pertinent case that illustrates these challenges. We recently managed a 68-year-old male with high-grade asymptomatic carotid stenosis. He was discovered to have 80% stenosis on routine screening following a referral from his primary care physician, who noted a bruit on examination. This patient, being a non-smoker with controlled hypertension and on statins with an LDL of 65 milligrams, represents a typical candidate for whom the decision-making is complex. Given the advancements in medical therapy, the initial approach was conservative. However, we also considered his individual risk factors, including his age and the fact that he had a high-grade stenosis. This prompted a discussion about potential revascularization, weighing the immediate risks of surgery against the long-term benefits of potentially preventing a stroke. Our decision-making was guided by current research and data from ongoing studies, like CREST-2, which is evaluating the efficacy of intensive medical therapy alone versus combined with revascularization. CREST-2 is particularly informative because it includes modern medical therapies and might provide the much-needed evidence to guide treatment choices. Another important consideration is the role of patient preferences and individual risk factors. In our case, the patient was relatively young and active, factors that might tilt the balance in favor of a more aggressive approach, like revascularization. However, it's also essential to consider the surgical risk, which varies based on the institution and the specific health characteristics of the patient. As we await more definitive results from CREST-2, our practice continues to emphasize a personalized approach. For this patient, after detailed discussions about the potential risks and benefits, we opted to enroll him in the ongoing trial. This decision allows us to contribute to the broader scientific community's understanding, while potentially offering him the most current therapeutic options. The management of asymptomatic carotid artery stenosis remains a challenging clinical dilemma. The evolution of medical management has significantly changed the landscape, reducing the stroke risk in these patients, and thus possibly diminishing the relative benefit of surgical interventions. As we continue to gather data from robust clinical trials like CREST-2, our strategies may further evolve,
hopefully leading to more tailored and effective approaches for our patients. This case exemplifies the complexity of decision-making in vascular neurology and underscores the importance of integrating historical data, current research, patient characteristics, and personal preferences into clinical practice. The ultimate goal is always to enhance patient outcomes while minimizing unnecessary risks.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Today, I will be discussing an innovative approach to the treatment of locally advanced rectal cancer, particularly focusing on patients with mismatch repair deficient tumors. This treatment strategy leverages the use of PD-1 blockade with the drug dostarlimab, a checkpoint inhibitor that has shown promising results in recent clinical trials. The discussion will delve into the molecular underpinnings of mismatch repair deficiency, the clinical implications of this new treatment approach, and a case study to illustrate the potential benefits for patients. Mismatch repair, MMR, deficiency is a condition where the DNA repair processes, which usually correct errors that occur during DNA replication, fail. This failure leads to microsatellite instability high, MSIH status, a condition prevalent in about 5 to 10% of colorectal cancers. Patients with MSIH colorectal cancer often have a poor response to conventional chemotherapy, partly due to the hypermutable state induced by the MMR deficiency, which can lead to resistance against chemotherapeutic agents. The standard treatment for locally advanced rectal cancer typically involves a trimodal approach: chemotherapy, radiation, and surgery. However, this regimen is not only harsh, involving significant toxicity and potential long-term morbidity, but also less effective in MMR-deficient colorectal cancer patients due to their chemo-resistance. A pivotal study conducted by Dr. Andrea Sursek at the Memorial Sloan Kettering Cancer Center explored the efficacy of dostarlimab, a PD-1 inhibitor, as a single-agent therapy for MMR-deficient, locally advanced rectal cancer. The study hypothesized that PD-1 blockade alone might be sufficient to treat this subset of patients by enhancing the immune response. Thus, it can potentially eliminate the need for chemotherapy, radiation, and surgery. The clinical trial involved a diverse cohort of patients, ranging in age from 26 to 78, with a significant number diagnosed with Lynch syndrome, a genetic condition associated with a higher risk of developing multiple types of cancer, including colorectal cancer. These patients were treated exclusively with dostarlimab for 6 months, with rigorous monitoring, including endoscopic exams, MRI, and PET-CT scans at various stages of treatment. Remarkably, at the completion of the study, 100% of the patients who completed the full 6 months of dostarlimab therapy achieved a clinical complete response. This means that there was no detectable sign of the tumor upon the conclusion of the treatment. Most importantly, these patients preserved normal organ function, avoided the severe side effects typically associated with conventional treatments, and had no instances of sexual dysfunction or infertility, common complications of radiation and surgical treatments in rectal cancer management. To provide a real-world context to these findings, let's consider the case of a hypothetical patient, John, a 45-year-old male diagnosed with locally advanced MMR-deficient rectal cancer. John is an active individual with a young family and was very concerned about the impact of traditional cancer treatments on his quality of life. After being diagnosed with MMR-deficient rectal cancer through immunohistochemical testing, he was enrolled in a clinical trial for PD-1 blockade therapy. Throughout his treatment with dostarlimab, John was closely monitored for signs of tumor progression or adverse effects. By the 3rd month of treatment, imaging and endoscopic evaluations indicated a significant reduction in tumor size. By the end of the 6-month period, John achieved a clinical complete response without any complications. His follow-up visits over the next year showed no signs of recurrence, and he maintained full bowel and sexual function, which significantly enhanced his quality of life. This case study highlights the transformative potential of immunotherapy in treating rectal cancer, especially for those with genetic predispositions like Lynch syndrome. The implications of such treatment are profound, offering a beacon of hope for many who are diagnosed with this challenging condition. It paves the way for further research into the use of immunotherapy for other MSI-H cancers, potentially replacing more invasive, toxic, and less effective treatments. As we continue to explore and validate the efficacy of PD-1 inhibitors, like dostarlimab, it is crucial for healthcare providers to test for MMR deficiency in early-stage colorectal cancer. Identifying this genetic marker can significantly influence the therapeutic approach, offering a tailored, less invasive treatment option that not only targets the cancer effectively, but also preserves the patient's quality of life. The ongoing research and clinical trials will further delineate the role of immunotherapy in rectal cancer, hopefully expanding its application to other cancers with MMR deficiency. This represents a shift towards more personalized, precise, and preservation-focused cancer therapy, heralding a new era in oncological care.